Okay folks, so if you're one of our regular patients, we've had a chat with you and we've seen your clinical notes and x-rays, and we think it's appropriate to provide you with a temporary filling kit. This is the general technique that you need to use, but we'll give you advice that's tailored to your specific needs. Typically you might have a situation where you've only got one wall of the tooth left and this is the cavity, or you might have both walls of the cavity left. If it's the first situation, get it nice and dry with cotton wool. The temporary filling material is already mixed, it sets when it gets wet. Good hard push, get it onto the cavity, push towards the wall that's remaining, like the inside wall, so you go the other way if the outside wall was still there. Have a quick bite together, very slowly and gently until you feel your teeth meet. You might then find that you've got a bit of excess that's been created by the bite that you need to scrape away. And that should hopefully then set and stay in place. Situation on the other side is a little bit harder to get dry, so might provide you with little brushes to do that. But it's more likely to stay in because it's got the two walls of tooth to hold the temporary filling in. So getting it nice and dry, shape the temporary filling material a little bit with your finger and thumb, pop it in place, little bit of a press, and again just a gentle bite together until you feel your teeth touch, and then again if there's any excess, a little bit of a scrape away with your finger just to get everything comfy to bite on. Obviously once it's set you're not going to be able to floss around these, there's a risk of you pulling them away, but again as I said, we'll give individual advice to each patient depending on their situation once we've actually triaged you. Okay, thanks.